Good afternoon. Thank you for joining us today for our weekly COVID-19 update. We know the focus primarily remains on interest around the vaccination administration and efforts. I think we are pleased that San Diego County is a top performer in the entire state. Our goal was to move swiftly to get as many vaccines in arms as quickly as possible. We were pleased to welcome Governor Newsom to San Diego this week to highlight the first vaccination superstation in the state of California, but more broadly than that, to highlight the fact that San Diego County again continues to be a model and a leader. We are encouraged by the speed at which we're moving. We're also encouraged by the demand for vaccine. I know in some points that causes frustration with people who want it now and they want to get vaccinated now. But I think as a county, what we are seeing is generally good in our ability to build out infrastructure, our ability to move rapidly from a vaccine received to a vaccine in arm, and certainly the public demand to get the vaccine is encouraging. Right now, the limiting factor continues to remain supply of vaccines. We could administer significantly more vaccines on a daily basis with the networks of sites that we built out, along with what other providers can do in the region. We just need the supply to kick up. We don't know. We think the next few weeks will probably be about what they've been the last week or so. But we are hopeful and optimistic that by early March we will see a significant increase and then we can move more rapidly through. Despite the supply concerns, we continue to build out our infrastructure. There's a tremendous amount of work that goes into standing up a location, identifying workforces, the scheduling component, getting all the protocols in place. And given the possibility that the supply could significantly increase within the next month, we want to make sure that we stand poised and ready to administer those. And so this week we are adding additional sites in both Vista and Del Mar to augment the rest of what we have up and running. Again, we will start doing some. It's based on supply, but we want to be prepared and ready to move forward. There have been some questions about first dose, second dose. So just to reiterate, as new vaccines come in, we honor second dose appointments first, and then with what we have left over, we open up new first dose appointments, and we will continue through that. While the superstations get a lot of the attention, we're obviously pursuing a very robust effort with a particular focus on reaching those communities hardest to reach, those underserved communities, those communities highest impacted by COVID, those that might have language barriers or lower income communities, less access to technology. And we do that through a variety of ways, both our community pods, which are embedded in the communities. They do fewer than the superstations, but they are doing vaccinations on a regular basis, along with the blocking of some of those appointments and teams of community healthcare workers who can go out and find seniors, connect them to appointments, and help facilitate their vaccination process. In addition to that, 211 continues to not only receive phone calls from seniors, but to schedule their appointments for them. And we are seeing those numbers increase and the ability to get those folks connected. If a senior who calls 211 does not have transportation, then we have transportation services available that can pick them up, transport them to the vaccine, and transport them back safely home. And we are scheduling those and doing those. For our seniors who are homebound, who cannot leave their home, even if transportation was available through our partnership with HEAL, this week we've begun going into those homes and vaccinating those seniors, again, limited to those who cannot physically leave their homes. And we are also, with our mobile teams through Operation Collaboration, some of our firefighter teams and Operation Immunization, some firefighter teams are now beginning to go into the communities to senior living centers and apartment complexes that are high propensity seniors, administering vaccines on site. All 86 of our skilled nursing facilities in San Diego County have been visited and received their first dosages at least, and 1,106 of our long-term care facilities have been visited and received at least their first dose. In addition to that, MTS is providing free rides to anyone who is going to make a vaccination appointment. So we have a variety of strategies and approaches, again, with a focus right now on administering vaccines to our seniors. And I think that it is an important point to reiterate that our seniors constitute the vast majority of COVID deaths, the overwhelming number of COVID deaths. And there is presently not enough vaccine to do everyone who is out and about to control the spread. And so the supply of vaccines we have is dedicated towards saving lives. And I think at this point of COVID, it's easy to get a little numb to the daily numbers. But yesterday we reported 51 San Diegans who died from COVID-19. Today we are reporting an additional 51 San Diegans who died from COVID-19. This is just over 100 of our fellow San Diegans who lost their life that have been reported in the last 48 hours. Out of these, 83 of them were senior citizens. And if we pause for a moment and think about if 83 people had died from some external or new thing in the last 2 days, we would do everything in our power to try and address it and stop it. These are not insignificant numbers in terms of loss of life. And we have something that can significantly stop it. That's the vaccine. And the vaccine getting in the arm of a senior can save their life. And that is why our focus presently is on senior citizens and will remain on senior citizens until every senior has been offered the opportunity to get a vaccine. Then we will be able to move on to that first tier of essential workers, that being teachers, educators, law enforcement, and food and agricultural workers. And we want to get there, and we want to get there as quickly as possible. But we have to make sure, again, that the vaccine has been offered to seniors. We don't know supply, and we don't know how many seniors will want to come to one of our sites and take it. I know Orange County and Los Angeles have said they think they'll get to that first group of essential workers in the next 2 to 3 weeks, and I would say we're on a similar trajectory, probably at latest 2 to 3 weeks away from being able to move into those tiers. But we are working to prepare for that. We're working to build out and have ready to go dedicated vaccination sites. We've been working with the County Office of Education and with VIBA to build out dedicated sites for teachers and school personnel when we get to that phase, to be able to have additional sites that they can go to focused on vaccinating them. With the vaccines going to schools who are open or who have a signed agreement to open pending administration of a vaccine. And I know a lot of schools are working on putting those packages together. We want to do it with an equity lens in mind and making sure we're hitting hardest served communities. But at our teacher and school personnel sites, those will be prioritized for schools that have an agreement to reopen pending vaccination or those schools that are already open. We're working with Scripps Health on dedicated sites for law enforcement personnel so that they can get in and get vaccinated when we open that, and we're going to have a particular focus particularly on those law enforcement personnel who work in our jails and those who work with high-risk populations such as homeless to make sure that they can get it and everyone else. And we're working with our grocery workers and grocery stores, again, to build out dedicated capacity for them. And then finally, our CAL FIRE teams that have been going out to long-term care and skilled nursing facilities, those will be ready to go into the fields to make sure we're taking care of our farm workers, again, some of the most vulnerable. And so we are not at the phase of this grouping of essential workers, but we are working tirelessly to prepare for that. And again, moving into that phase is predicated on supply, and we hope to see that increase, and we will keep doing everything we can to move rapidly through these tiers and get as many people vaccinated as quickly as possible. With that, let's jump into our slides for today. You'll start here with our dashboard. What we're showing here, the 651,450 is the total doses that have been received into the region. This is what has physically shown up in San Diego County. Out of this number, 550,707 have been administered, a mix of first and second dosages, but that's what has been put into arms. We know of 8,155 vaccines that have been administered. They're just pending the upload into the system. And we have 92,588 doses to be administered. These are upcoming appointments. Now, if you add up those bottom numbers, it is more than the top number, but we do know and are hopeful that additional vaccines have been shipped but not received. And again, we'll continue to work to limit new appointments to vaccines we're confident that we have. And then you can see on the right-hand side, 15.5% of our adult population have received at least a first dose, and 3.3% are fully vaccinated. They have received both first and second dosages. Next slide. Here you just see the map. Again, this is the network that is being built out. The stars representing those super stations, most capable if you have supply of doing up to 5,000 or a few even a little bit more per day, but again, very limited on supply. You see the new superstation coming in North Coastal. And then the triangles representing our community pods, points of distribution, again, embedded in the community, harder to reach folks, a lot of targeted efforts around getting people plugged into those. And we think this network is robust and can certainly do exponentially more vaccines than we're doing now. We're just waiting on supply. As it relates to cases, you'll see here we had 3 days in a row under 1,000. Encouraging today, a little bit over 1,000. Again, it's not the day-to-day number, it's the overall trends. And again, the overall trends are generally positive. You see that purple line, our 14-day percentage of positive, again, continuing to trend down. We will have to see where this goes, but we are hopeful that people continue to understand the actions that brought our case counts down are the actions we need to continue our case counts going down. And with the presence of new, more contagious strains, we don't want folks to relax their posture around taking action to slow the spread. Again, generally good trends in hospitalizations. On the next slide you see here, our COVID-related hospitalizations, again, continue trending down, not as rapidly as cases, but that makes sense because of the lag. But both COVID hospitalizations and COVID ICU utilization, again, headed in the right direction. On the next one, you'll see the total ICU system. We've talked about this a great deal. As the number of COVID-related ICUs shrinks, the non-COVID ones will increase. Our healthcare systems are catching up a backlog of deferred procedures. So that staffed and immediately available number of beds probably will not fluctuate much for quite some time. And then this last one here, second to last one, is just a reminder to us all that COVID continues to be deadly. Yesterday we reported 51 fatalities as a result of COVID. Today we are also reporting 51. And again, out of these 102, 83 of them were senior citizens, which again reinforces and reminds us why we continue to focus on vaccinating seniors today. And then final chart just shows where we are on the path descending to a lower tier. You can see it wasn't that long ago. Our unadjusted case rate was almost at 100 at 97. We have now cut that by 2/3 down to 35. But we need San Diegans to help us. We need San Diegans to continue to take action to lower the spread. Getting in lower tiers obviously means more of our businesses that can be open, greater ease for our schools to get open, more youth sports, and lower spread, of course, means lower hospitalizations and less deaths. But we're generally encouraged by the trend for where we're headed, and we hope to keep it going that way. With that, let me turn it over to Vice Chair Vargas for her update, and then both Dr. Wooten and Dr. McDonald are here for your questions.
Thank you, Chair Fletcher. So I really wanted to take this time to address some of the concerns regarding the equitable distribution of the vaccines, especially in communities of color. We know that the vaccine numbers in our communities of color remain lower, right? 14% in the Latino community, 11% in the Asian community, 2% in the Black and African American community. But I really want to emphasize that these numbers are reflective of the different vaccination phases, which at this time only include healthcare workers and seniors 65 and older. What the county is doing is strengthening our infrastructure to ensure communities of color and vulnerable populations to have access to vaccines when it is their turn. For example, our 65 and older population has challenges accessing appointments due to barriers such as language and technology and transportation. As Chair Fletcher mentioned, we really are looking at the different impacts that they're having so we can make some of those changes, like making sure that we're expanding capacity at 211. And so we're able now to serve the 65 and older community to help schedule their appointments and find transportation for them. At last week's press conference, I announced the launch of a community health worker promotora pilot program. The goal of this pilot program is for these health workers and promotores to conduct outreach to our most vulnerable populations with the goal of providing access to appointments. 100 promotoras, community health workers, have been trained, and several are still in the process of receiving training to conduct outreach and begin the appointment setting. This is an important pilot program that we're doing in the South Bay, and the county has blocked appointments between the hours of 9:30 and 12:30 at our 4 community pods, including San Isidro, Imperial Beach, Chula Vista, and National City for these appointments. We want to let everyone know that we're listening to the feedback and are doing everything to ensure all of our communities are informed and have access. I do want to make sure we emphasize to all of our friends and families that live in mixed status households, please remind everyone you know that the information that is gathered at these vaccination centers, the information is confidential. It is not being shared with federal agencies. And we want to make sure that we continue to emphasize the importance as people's turn comes up, that we want them to get vaccinated. Also important to mention that this, for many folks, this is a President's Day weekend holiday. Please remember that COVID doesn't take a holiday, that we want to make sure that people continue to wear their masks, continue to stay in their hubs, and they're really making sure that they're taking care of each other. And for those of you that are celebrating Valentine's Day, please stay only in your families and try not to be out there as much because we want to make sure that you stay protected. And the other thing, last but not least, I want to thank all of the organizations that are coming up with different ideas and ways to making sure that we are helping our communities fill out their appointments so that we are able to get their vaccinations as soon as possible. Lo que me gustaría compartir con ustedes es el trabajo que estamos haciendo para garantizar que la distribución de vacunas se esté realizando de manera equitativa. El condado sigue desarrollando una infraestructura que da prioridad a nuestras comunidades más vulnerables. Hemos escuchado los comentarios de muchos miembros de la comunidad que nos han compartido sus retos para hacer citas para vacunas. Nosotros hemos estado trabajando colectivamente para ayudar a eliminar estas barreras, ya sea en el idioma, la tecnología o transportación. Quiero enfatizar que ahora 8 centros de vacunación comunitarios están en el área del sur de San Diego. Estas son muy importantes porque nos hemos asegurado de haber identificado lugares con los que la gente está familiarizada. Lugares donde la gente ya conoce porque se han hecho su prueba de COVID ahí o antes de la pandemia era un lugar que visitaban para obtener recursos. También nos hemos asegurado de que estos centros de vacunación comunitarios estén cerca del transporte público. A partir de esta semana hemos podido ampliar la capacidad del 211 y sé que todavía es difícil cuando hablan porque todavía dura un poco de tiempo, pero ahora podemos servir a la comunidad de 65 años o más para ayudar a programar sus citas y acceso a transporte. En la conferencia de prensa de la semana pasada, anuncié el lanzamiento de un programa piloto de promotores. Estos promotores se van a comunicar directamente con personas de la tercera edad para apoyarlos en hacer sus citas para vacunas. Estas vacunas se están haciendo en los sitios, es un programa piloto en el área de San Isidro, Imperial Beach, Chula Vista y National City para hacer estas citas. Lo importante es que una vez que funcione el programa piloto en el sur de San Diego, lo podemos expandir al condado en general. A final de esta semana pasada y esta semana, cerca de 100 promotoras han recibido entrenamiento o están a punto de recibir entrenamiento para hacer estas citas. Es muy importante enfatizar también para las comunidades en donde nuestras familias tienen un estatus migratorio mixto, importante reafirmar que no tienen que tener más que un ITIN número o si no poner 00 en la aplicación para que se les pueda dar sus vacunas, que la información que usted pone para hacer la cita es completamente confidencial. Esta información no se va a dar a las autoridades federales, ni mucho menos a ninguna otra organización. Es importante enfatizarlo porque sabemos que mucha gente está preocupada. Y por último, este fin de semana para muchas personas es un día festivo. Este lunes, el Día del Presidente, y además pues el Día de San Valentín el sábado, pero queremos enfatizar que es muy importante que sigan usando sus cubrebocas, que sigan siguiendo todos los diferentes métodos que existen para protegernos y esperamos que todos ya lleguemos para que tengan su vacuna y estar seguros. Gracias.
Thank you. We'll now go to our call-in questions.
Hello, the first call is from Tommy Sablon with KUSI.
How you doing, Chairman Fletcher?
I'm good.
There are 45 states that do not have school closure orders. San Francisco and Chicago are now reopening their schools. Long Island, New York just started to let their high school athletes play sports, and it's going great. Cities all across the country are reopening businesses. Our case rates here in San Diego and ICU numbers are as good, if not better, than theirs. Why is their science different than San Diego County, and why are we so behind?
You would have to ask them, Tommy.
I know, but with all due respect, but I'm asking you, Nathan. You know I am, and I'm not asking you as a reporter or anything. It's me, Tommy, and I'm asking you as person to person to Nathan. I try every week to ask a question respectfully to you, and and you're the chair. You're the boss.
Tommy, you're asking me to speculate on why some other state is doing something, and I can't speculate on why some other state is doing something. I can tell you that in San Diego, in the state of California, we are advancing on reopenings. We have more businesses open today than we have a month ago. We have more youth sports open today than we have a month ago. Considerable effort is going into getting schools reopened. And so we're continuing to work through that. We're a leader in administering vaccines. Our cases are coming down, and I think we're headed in the right direction. The way that we get more things open is to continue to get more people vaccinated and continue to have our case counts go down. And as we do that, then additional things will become open, and we'll work our way out of this.
Do you personally believe schools in San Diego should reopen?
I want to get schools safely reopened, and I think what you're going to see is a plan. I talked today to both the head of the San Diego Unified School Board, Richard Barrera. I talked to representatives from the teachers, San Diego Education Association. I've talked to the superintendent of public instruction, and I think they are coming up with very robust plans to get our kids back in school. And I think the vaccines play a critical role in that, and I believe that we can find a way to safely get our kids back in school and protect our teachers. And I am encouraged by where we're headed and the direction we're going.
This next question is from John Wozen with the San Diego Union Tribune.
Hi, two vaccine questions from me. The first regarding the vaccine dashboard. I may have asked about it last week, and I think it got buried with other questions. Yeah. Why is it that about 15% of the data on that dashboard is race or ethnicity unknown, and then there's another 12% that's, other race, 15%, and then 12% unknown? Just if you could provide any kind of clarification on why there are those two fairly big fractions that we can't really account for. And the second quick question is about whether we've learned anything more in terms of the county getting reimbursed by the state or federal government for the vaccine rollout. Do we have a sense of whether we've gotten any money just yet, if any's on the way? I know you've talked in the past, Supervisor Fletcher, about hoping to get reimbursed, but not being certain if that would happen. So any update on that would be great.
Yeah, so I apologize. I remember you asked that last week, and it did get buried in a whole bunch. That's my apology for that. We've been working to try and unpack this number of both the two categories which you outlined, the race and ethnicity unknown, and then the not stated. As best we can tell, there's just a significant number of people who are choosing not to check a form or check a box on what it is. And so we have now started graphically showing that's in there. And then the other one on the other, it is just a combination, again, of factors. We think, perhaps some of the vaccination forms are not as specific. Sometimes people maybe of mixed race and don't want to pick one or the other. But we've certainly expended considerable effort to try and get better data and better clarity around that. Again, we are limited a little bit on what people put when they go through the form, but we are aware of it. We've been working to try and see if we can get it, a little bit better reporting on that. And we're going to continue to try and do that, because I don't think right now the numbers really paint a clear picture when you have such a not insignificant number of the total that are not identified. So variety of factors, people choosing not to do it, people choosing not to pick one of the various options, and we're going to continue to work through that and try and do it. Again, we're collating data from a lot of different sources, and I think as we get into more consistency around the utilization of my turn, some of that will become a little more clear and will help us a little bit as we go. So very aware of it, working hard to try and make it better, and we'll continue to update you on the progress of that. As it relates to the financial aspects, we do know money is on the way. We are not overly concerned that we will not be reimbursed for costs. We made the early decision to just go and expend the funds, believing the funds will come. I am more encouraged now than I was then that we will get fully reimbursed for costs surrounding vaccines. And again, money's beginning to trickle in, beginning to hold, hey, prepare for this, prepare for that. But we feel confident that we'll be able to fund all the operations moving forward.
Thank you.
Thank you.
This call is from Artie Ojeda with NBC7.
Good afternoon, everybody. We know the priority is, in fact, to vaccinate healthcare workers and people over 65, and so far, based on today's numbers, the dashboard showed 3.3% of that group is fully vaccinated. So my question is, what specific metric are you looking at before we can move into the next tier that includes teachers, law enforcement, and food workers? And did I hear you correctly that that could happen in 2 to 3 weeks?
Yeah, Artie, what we're looking at is just a sustained availability of appointments. And I think it's important to keep in mind when you look at the significant number of first dosages we've done, all of those folks are going to come back for a second dose. And so that'll limit a little bit the availability of new first dose appointments. But as we get into a place where first dose appointments are systematically not being filled by seniors, then we will want to open up again to those tiers of essential workers. Now, understanding the minute we do that, there will be a severe shortage of appointments because, again, you're injecting a very large number of folks into a system that has limited supply. But it isn't a specific numeric number of once we hit this number, it is more a supply and demand issue. And so when we see that the demand is not meeting the supply for vaccines in a systemic way, it doesn't mean one place at 1 hour, in a systemic way, then we'll be prepared to do it. And it's really hard to predict when that'll happen. I feel very confident it will be within the next 2 to 3 weeks at the latest that we will be able to move into that next tier. But again, the minute we have available vaccines that are not being taken by seniors, then we will move into that next tier.
Awesome. And let me just follow up too on something that you mentioned earlier regarding your discussions with school leaders today. Based on those conversations, do you have any kind of a thought on a timeline when schools could, in fact, begin to reopen?
Yeah, I should probably let them make their own announcements. I know they're working hard, and I think they're getting close, but we'll see.
Our last caller is Paul Sisson with the San Diego Union Tribune.
Thank you. I wonder, given the current constraints on vaccine supply, are local residents getting their doses in the recommended 21 to 28 day time frames? Are some waiting longer? And what has the first dose, second dose split been in the last week or so as so many second doses are coming due?
I'll let Dr. Wooten tell you. To my general sense, Paul, the people they're able to schedule the second dose appointments are able to be made. I know we have the cumulative first dose versus second dose should be up on our dashboard. I don't know off the top of my head what that number is for the last week, but we could probably look back and just do the math on that and pull that for you for what it's been first dose, second dose for the last week. I understand that why that would be of interest. I don't know it off the top of my head, but Dr. Wooten doesn't know either. So Paul, we'll try them. That should be an easy enough number to pull for you, and we can send that to you and provide it. But to our knowledge, folks are not missing second dose appointments. We've had enough supply of vaccines to meet the need for second dosages.
Another question regarding B117 variant. A few weeks ago, it was predicted that this variant was going to gain dominance pretty quickly. The numbers we've seen in the weekly county reports seem to indicate that we're still around 150 or 60 or 70 total 117 cases detected so far. Does that mean that this thing isn't gaining prominence as quickly as was predicted by the modeling?
We'll have Dr. McDonald address that.
Thanks, Paul, for that question. I'll just give you the latest update on the numbers for B117. There have been, as of the close of business yesterday, 163 confirmed B117 cases and 47 probable cases. And you're right, the numbers have not been increasing quite as fast as we had thought might be the case based on the information that we had about transmissibility in England. And interestingly, the other hot pocket area in the United States for B117 happens to be Central Florida. And they are seeing a increase in cases there that is below that was seen in England, but is actually higher than that we saw here. And we're actually trying to figure out why that is epidemiologically. It might be the specific subgroups of people who actually have this variant in San Diego versus Florida versus the UK. It might be that there are other ecological factors or environmental factors about the way we interact with each other in Southern California versus England and Central Florida. There's probably a couple of factors in there, but you are right. It's not increasing quite as fast, but yet it's important to note that it is increasing. And sometimes in the first few weeks of what can become an exponential curve, you got to be careful about being lulled into a false sense of security. So I think we'll know a little bit more in the next few weeks whether this variant really takes off the way that we think it might.
Thank you.
Thank you, Dr. McDonald. Real quick, Jonathan from the UT, I just confirmed we have not received any reimbursements yet. I did allude to the fact we've been told money was on the way, but we have not yet received any actual reimbursements in the bank. But checks in the mail, probably. Next question.
First text question is from Chris Genowine with Times of San Diego. He's asking, we're getting many questions from San Diegans just slightly younger than 65. Do you have an estimate of when phase 1C vaccinations will begin?
Yeah, we just really don't. It's the same reason we can't say with certainty when we do our first group of essential workers. We think that is in the coming weeks, not months, certainly in the coming weeks. But we wouldn't know when we would get through that and move to the next group. And so we've always tried to tell you what we know and tell you what we don't know. And we don't know what the supply will be. We don't know exactly what the demand will be. And so we just really can't speculate that far out.
Next text question is from Jared Ahrens with ABC 10 News. Informal caregivers are now a priority group for getting a vaccine. Can you clarify what qualifies someone as an informal caregiver? What kind of proof do they need to show? And how do you ensure people aren't abusing this as a loophole to jump the line?
Yeah, for that program, it requires a doctor's note for a doctor to certify and verify that. And they have to produce that at each of our sites when they arrive for an appointment.
Next text question is from Lauren Mapp with the San Diego Union Tribune. Have all residents in long-term care facilities now received the first dose of the vaccine? How many have also received their second dose?
Yeah, Lauren, out of our long-term care facilities, 1,106 of them, which represents 82%, have received their first dose, and 217 which represents about 20% of long-term care facilities have received the second dose. For skilled nursing facilities, 100% of our skilled nursing facilities have received the first dose, and 72% of our skilled nursing facilities have received the second dose. So we're moving rapidly through those. Skilled nursing facilities have all received the first dose. The vast majority of long-term care facilities have received the first dose. And then we will keep working through those. It's a high priority for us. It's a little harder because you have to go to each of them, and it's a little more work or infrastructure, but we've made it a high priority, and we're getting rapidly through those.
Lauren asked a follow-up question. She also wants to know when people with underlying conditions who are under 65 will be able to receive the vaccine.
Yeah, it's just the same issue around timing. We just don't know. It's based on supply and demand. We know what we're doing right now. We know what comes next. And then beyond that, we'll have to see as we move forward. We're hopeful that the availability of vaccines will increase significantly, hopefully in March. But at this point, we just don't know.
This last text question is from Mike McKinnon with KUSI. Major League Baseball allows counties the discretion to allow fans to attend games in person. Would the county advise the state that in-person attendance can be safely done so that Padres fans can support their team on opening day?
Just depends on where we are at opening day. That it? All right, that concludes our briefing for today. We want to thank you all and again appreciate everyone's patience as we work through the vaccine process. Let's continue to drive those case counts down, drive the vaccine numbers up, and work our way out of this. Thank you all. Have a good day.